Welcome back. Posture, TL.
Oh, hi.
We, of course, are talking to Nathalie Beauchamp, chiropractic doctor. We want to jump right into this next one because we talked about, you do various scans for people, right? Now, describe what we're seeing on here. Is this a scan that you've actually done of somebody?
Yes, this is a scan of a patient, and it's so visual when we can click. So the scans measure how your nervous system. This particular example is a thermal scan, which measure how your organs are working, your heart, your lung, your stomach. Now, white is normal, green is mild, blue is moderate, and red is severe interference. Okay? So we can clearly see this patient has interference as C1, right? But look at what happens if I click on it. It shows everything that's affected by C1. Why is it lightening up everything? Is because C1 is right here at the top, and it's a direct connection between your brain and the rest of your spine, right? So if you have a subluxations there or misalignment, it will affect that, okay?
Wow, now that's a lot of stuff.
That's a lot of stuff. And now you can see how some people...
I'm probably a C1. This is what scares me, Natalie.
Wow. Well, we'll have to talk. Now, let's just take the other red one here, which is T8. Okay, so you can see here that, whoops, I'll just put back my mouse here. So you can see that it goes to the liver, the gallbladder, and so forth. So that means that the signal from the brain to that organ are not working the way they should. Can this person be symptom-free? You bet.
Right.
Only 10% of the nervous system perceive pain. So that's what's very interesting and powerful with these tools, is that we measure what you don't feel.
Right.
And I give the sad example of cancer. You don't go to bed Friday night without cancer and get up with it Saturday morning at 8. You know, you had it. You just didn't feel it.
Yeah.
Same thing with heart disease or the person dying of a heart attack like this, no symptoms. So I think we have to sort of start thinking that, you know, no pain doesn't mean necessarily healthy. And these tests are really great to see how optimal your body is functioning.
When you say interference, are you talking about like a pinched nerve? Like we would think of it as a pinched nerve.
You know, it's a very good point. And in layman's term, that's sometimes how we will explain it. But to have pressure on a nerve is the weight of a dime. Do you know how little a dime weighs? This is the amount of pressure to disturb the nerve flow.
If there was the weight of a dime, would we be in the green or the blue or the red or the white?
Probably in the red.
Wow.
Okay, so that's why people, when you have a pinched nerve, like a real pinched nerve, like you'll have numbness and tingling down your arm, and you know we're most likely talking about herniated disc. That's an extreme case, and you don't want to get there. So it's not just about pinched nerve and removing the pain there, but it's optimal nerve function. You know, I was interviewing a friend of mine yesterday, and he's a chiropractor himself, but he had a great story how he had sinus issue and headaches and so forth, hurt himself, went to see the chiropractor, everything got better, but on top of that, sinus problem, headaches, his energy, his mood was better. So he didn't go in for that, but that was I call it a side effect. Right? Exactly, just because of optimal function.
So with this person that's got, you know, such a great problem with the C1, what did you do as far as an adjustment that you made? Did they come in for one? Did they have to come in?
Very good question. It all depends. And when I do my doctor's report, I always tell patients that their color on their scan is like stain on a carpet, meaning how long has the stain been there, or how embedded is it? Right. So maybe it's not that deep, and within, let's say, 10, 12 adjustment, we can see a change in the scan. Sometimes they get worse because of lifestyle. We talked about the 3 stress: physical, psychological, nutritional. I can adjust people, but if they go home, they hate their job, their kids are driving them crazy, they're 50 pounds overweight, and they smoke, we have some issues here. So it's not just that, it's the lifestyle that goes with it.
Can we see, this is the one you said is the thermal, which is the organ. Can we also see the muscle?
Well, I'm going to stay on this screen just for saving time, but the left side, it would be the musculoskeletal system, so you can see. So if I take, for instance, let's take a lower here, T12, you can see how it's going to affect the lower back. If I did take C5, it would affect the arms and the hands. And the musculoskeletal system is easier for people to understand, it seems, but it's when it comes to the organ, it's like, wow, you mean the pain that I've had between my shoulder blades for years is affecting my digestion, and that's why I'm not digesting properly? Wow. You know, people just don't connect these things. People don't know what's
going on inside them. I mean, that's the thing. And I'm glad you mentioned the fact that you're really about creating an entire wellness program for somebody, right? It's not come in, do an adjustment like you said, because if they go home home
Yeah.
and start eating fried foods every night and
Yeah.
smoking and drinking, well, it doesn't matter how many adjustments
Exactly,
you've done, right?
exactly. So that's why at the clinic we're also a creating wellness center. And Tihal, you had your evaluation, and with this technology, we measure your neurospinal function index, and we have a joke in the office. What's your number? You know,
Yeah,
not
what's
your
your
phone
number?
number, but what's your number?
That's my number, actually, 107.
And then we have the creating wellness number. So we have
Oh,
two
there's
things.
different numbers,
One's
okay.
the number for the nervous function, and the
Okay.
other one is for the wellness quotient. And yes, TL, if you don't mind, we can.
Yeah, I don't mind.
We're going to use TL as our guinea pig?
Yeah.
I
Well,
love this show.
Do you have my scan thing? I don't know,
Not on
right?
that screen.
But mine was, I'll tell the viewers, mine was like red all the way down. It was terrible.
This scares me because if you're like that, and TL, I mean, she exercises,
know,
she
really,
eats
I know.
right.
I'm really
I
diligent.
am probably the opposite.
Oh.
So if you were red everywhere, I got to
I
come
was
in
red
and get
everywhere.
a
I
scan.
can't wait because I'm almost time to get
Yes.
my new scan. I
Yes.
can't wait to see, because I do notice differences when I go get the adjustment. I always sleep better that night. Always. I have a deep sleep that night. Like,
Right.
wow, wow, wow.
Yeah.
It's amazing. So,
Yeah.
okay.
So the score, and if you don't mind, I'm going to just put this up here so we can see. So the score is from 0 to 200, and anything below 100, we're aging before our time. We don't want
Okay.
that, right?
Right.
No.
So TL score was 107.
Oh, I just got past.
Pretty good. Pretty good. And
I know.
what it means is that if you're in very challenged, that's people that are usually using medication every day, they're just getting up tired and no energy and so forth, and you know, as you move on the scale. And if I look at the results here, and is separated in 3 sections. So the first one is the physical dimension. You don't mind we're showing this?
don't care.
Okay, all right.
No, it's fine.
Just want to make sure. So in TL's case here, she was challenged in her torso strength and her leg strength. So we measure physical parameters. So that's what came out with this. And her sleep was challenged. So glad to hear that's doing better. And then in the biochemical dimension, we're looking at what you eat, the water intake, fruits, vegetable, organic lifestyle, all of this. Body fat percentage, girth, and BMI, again, for risks.
Right.
And then the last one is a psychological dimension. And a lot of programs have the physical and nutritional, but we forget about the psychological. So
I had a lot of challenged in that one. I did.
well, we're busy, right? So you're trying to do a
Because
lot
I'm
of things.
stressed.
So, and is that like a question and answer thing that you
Yeah, well,
did with
actually,
TL
great.
for that part?
Part of it is an online questionnaire, and
Okay.
part of it was her coming to the office. Lung capacity was checked, stress profiler, you know, all these parameters.
And then the
that she
rest
had
I
to
did
do.
on the computer.
Well, I'm gonna review all this
Yeah.
information,
Dr. Nathalie, I mean, we've got so much more. I can't wait. You're going to be with us once a
Yes.
month, so we're going to there's so many more scans, more this, more that. So we're going to learn every single time. Thank you for coming
So
today,
now he
though.
has something on you.
Yeah, I know, exactly.
Well, don't worry. When I go get mine done,
Yeah, I know.
I'll be blown right out of the water. Hey, listen, don't go away. We're going to come back and tell you why you should quit smoking and a great incentive. There's a fantastic challenge happening in the month of March. Don't go away. We'll be right back.
Thank you so much.
Yeah, that was
really great.